Hello, everybody. My name is Dr. Stephen Stokes. I'd like to talk about Parkinson's disease. I've treated it for over 20 years. I've seen lots of patients with Parkinson's. Let me state, I do not have a cure for Parkinson's disease. What I present here is my clinical experience with the disease, the protocols that I've developed that have helped patients reduce symptomatology using natural methods, right? And also, in some cases, put the disease in a holding pattern. Dare I be as optimistic to say in a remission? And I've seen that with these protocols. So if you're suffering from Parkinson's, or if you'd like to know more about the disease, this is a useful video. There's 1 million people in the United States with Parkinson's disease. There's 60,000 new cases every year in the over 65 population. We normally see the onset of these symptoms in the mid-50s. But this disease, unfortunately, it starts much, much earlier. It probably starts in the late 20s, actually. And some of the early symptoms we see have to do with the bowels and constipation. Patients who come to me with Parkinson's tell me that they have had problems with constipation from, their mid-30s or something like that. So it seems to start in that bowel area, and it's something to be aware of because once you start to get the mainstream symptoms of Parkinson's, about 80% of the brain is already damaged, right? It's a very depressing sort of overview, right? So we want to really get at this disease early. We want to do things to prevent the onset of Parkinson's. And if we're starting down that road of Parkinson's degeneration, we definitely want to slow down the process of the disease by understanding the mechanisms, and that's what I'm going to go over here today. We talk about symptoms, and just to go back to that for a minute, another thing that we see a lot of is in your writing. So, if you're writing your name or something like that, with the onset of Parkinson's, the person will start to write very, very small and compressed. So the writing looks like it's squeezed down into a very tiny letters. That's something we see. We also see, of course, the stereotypical Parkinsonian tremor. And this is unique, right? This is called a rolling pill tremor, and it kind of looks like this, as opposed to an intention tremor, which is more just of just a vibration. It's very different. And this rolling pill tremor is unique in that it alleviates with movement. And most tremors get worse with movement. So it has that, which is different. It's a distinguishing trait. And also the idea that it improves with movement, it really opens up the discussion to what's really happening with this disease, right? When movement seems to alleviate symptoms, that's opening up doorways that we can investigate as far as maybe coming up with a viable treatment protocol, right? Because it seems that movement improves. A lot of the patients I see tell me they feel like they're wearing concrete blocks for shoes. And when they tell me that in the clinic, the first thing I always do is I stop and I go, and I look down there, right? And everybody has a little laugh and it breaks the ice. I just want to make sure they don't actually have on concrete shoes. But it breaks the tension, because this is a very upsetting diagnosis for most people. People feel that it is almost a terminal, hopeless diagnosis, and it is not. You can really do some great things while you have Parkinson's in slowing down the progression of the disease. That's what the focus of this video, that's what we're going to talk about here. I want to also bring to the forefront that with a Parkinson's diagnosis, we see emotional considerations. Parkinson's patients will get angry very easily. They suffer from depression most of the time, feelings of hopelessness. They, like I say, they lose their temper. They feel worthless. And they get this strong desire to isolate themselves from others. This is very important if someone you love or someone you care about has Parkinson's, or I guess it's important if you know anyone that has Parkinson's, because they're going to present in a nasty way. And it's easy to say, well, that guy's just a jerk, or that woman is just a jerk. No, it's usually to do with the brain degeneration. We need to understand that so we can create some empathy for that person, so we can help them, right? This is the key. Also, we'll see facial expressions are very blank, very drawn, motionless. And another thing I notice is when they get up out of a chair, it's hard for them to to get up out of a chair. And when they do, they have to take a few seconds when they're standing to sort of get their bearings before they start to walk. And then when they walk almost as if they're falling forward and just catching up. And this is a very typical sort of Parkinson gait, I suppose. It has a lot of negative effects on the posture. That's something you'll notice. They're humped over, they're drawn, they're tight, they're rigid. And another thing that we need to talk about here is stress. So unfortunately, when you get a Parkinson's diagnosis, it's a very stressful time, right? Stress really manifests the disease. It really increases the progression of the symptoms. And so, it's a horrible discussion to have with a patient because they understand they have Parkinson's, they're worried, they're nervous, they're scared, and then you're telling them, calm down, don't be stressed out. And of course, stress is the number one thing that they're going to have. They're going to be freaking out. And so let me start the discussion about treatment by saying you cannot treat Parkinson's unless you first and foremost get stress under control. It is the most important thing you can do. You have to balance the sympathetic nervous system. I have made several various videos about this where we have to get the balance between the sympathetics and the parasympathetics. We have to get the fight, flight, stress activation curtailed, dampered. And so in a lot of my patients, I get them right away taking valerian complex, which of course is my favorite de-stress herb. And valerian complex is going to not only reduce the feelings of stress, reduce the symptoms of a sympathetic activation by reducing cortisol and reducing adrenaline and all these hormones. It's going to calm them down without making them dopey, but it's also going to train the nervous system over time. And that's why valerian is so important. The nervous system sees what it feels like to relax in a stressful situation. And then the nervous system says, oh, okay. And the next time it's stressed, it remembers that and it uses that as an archetype or as a mold, as a prototype for how to deal with stress. It's very important. Now, in your brain, you have a section called the substantia nigra. And the substantia nigra is the action spot when it comes to Parkinson's. Those neurons, they produce dopamine. And dopamine, you can look it up, has many different positive effects on the body. It has to deal with motivation. It has to deal with coordinated movements, all sorts of interesting things. Well, those neurons in your brain stop producing dopamine. And as a result, we start to get all these symptoms of Parkinson's disease. Now, the issue is that with the medical community, the goal is to, of course, increase dopamine. So you would think, let's just give the person dopamine. But dopamine doesn't cross the brain-blood barrier. So you can't just take dopamine and get it into the brain, okay? So the medical community has a drug, Sinemet. And Sinemet is L-DOPA. And L-DOPA gets into the brain and it mimics dopamine. But it has some pretty nasty side effects and it produces a lot of free radicals in the body. These free radicals increase the progression of the disease. So I'm just going to leave that with you, right? So, you talk about a catch-22 or a paradox. You take the drug, in particular, in this case, we're talking about Sinemet. You take Sinemet for Parkinson's. You increase basically your dopamine by this synthetic version, this L-DOPA. But then the side effects of that can make the disease progress quicker. It's a devastating place to be, right? And so let's just come back a little bit from that. And let's talk about ways that we can get the body naturally to handle the Parkinson's diagnosis better. The first place we have to start after we handle the stress is with the liver. If you have a Parkinson's diagnosis, for that matter, if you have an ALS diagnosis, if you have MS, if you have any type of neurological degenerative diagnosis, even if you have a diagnosis of arthritis, I'm here to tell you that I'm 100% certain from 22 years of practice that you have a liver that is not working properly. And so the liver does many wonderful things, right? It detoxifies the body. It does so many vital things to our system. But in this case, what we're talking about is the liver's ability to convert this acid called linoleic acid and also linolenic acid to something called arachidonic acid. And we have to have this arachidonic acid to do all of these functions in our body. It is a vital acid that we need. We need it to actually make the cells of our body. If you're not converting to this acid, if you're not able to do that properly, you're going to have all sorts of problems. And in particular, you're not going to be able to heal and regenerate properly. And you're going to get caught in a chronic disease pattern. So the first and foremost thing we need to do with a person that has Parkinson's disease is we have to make sure they're getting large amounts of arachidonic acid in their system. We do that with a supplement, right? The supplement I recommend is called Super EFF, and it's got a fancy name, right? But it is super. It's a super product. And what Super EFF is essentially beef liver. And that's where we're going to get the best source of this arachidonic acid, because our body is not going to be able to convert into that naturally. We want to give it what it needs so we can get on with the regeneration and the healing. And so that's the first supplement that I really recommend is everybody needs to take this Super EFF supplement. The next thing we want to talk about as a little side quest, if you want to say that, is if you are diagnosed with any kind of neurological degenerative condition, be aware of aluminum. And I know this was popular back a few years ago, but it kind of has died out a little bit, but I'm here to bring it back. I'm telling you, avoid aluminum at all costs. Aluminum creates a toxicity with your neurons. You have to avoid the aluminum. So use deodorant, not antiperspirant, because antiperspirant is aluminum-based. Most of them are. So use a deodorant. Don't cook with aluminum pans. Eliminate aluminum from your cooking powders and things like that. You have to get off of aluminum as well. If you're dosing your body with aluminum every day and then you're trying to heal the neurons of your body, I mean, it is a real uphill battle. So I want to emphasize, get aluminum out of your system. If you feel as though you are overly toxic, then I would recommend taking a powder shake called SP Balanced Detox. This is going to have a lot of cofactors and a lot of supporting herbs for the liver, and it's going to help your body go through phase 1 and phase 2 detoxification easier. It's not going to be a big contraindication if you have the disease, but it's just going to help you detox a little better. And we talked about the free radical damage by taking Cinemet. These free radicals are the enemy with Parkinson's. You have to get free radical damage under control in your body. And taking SP Balanced Detox, take one of these shakes every day. It has some natural plant-based protein in there and a lot of other great things. It's a nice way just to cover all your bases from a nutritional perspective and also assist with eliminating these free radicals from the body if you have Parkinson's disease. We talked about constipation in the very beginning and how constipation is something that we see early on. There is definitely a connection between gut dysbiosis or dysfunction and Parkinson's. It is believed that the pathway involves the vagus nerve. And so we think of a lot of times as the vagus nerve as the nerve that sends signals from the brain down to the gut and to other parts of your body, actually to almost every part of your body. But it's a two-way street, right? So if you have dysbiosis in the gut, which a lot of people do, meaning an imbalance of gut flora, that pathology can also travel upwards or upstream or backwards or reverse or however you want to think of it, up the vagus nerve directly into the brain. And so we want to eliminate dysbiosis in the gut. We want to help with that. One of the easiest ways to do that without going into a very in-depth gut discussion, which I've done on other videos, is to simply make sure that you're getting prebiotics, right? These prebiotics are very important because they give the gut the food it needs in order for the good bacteria to overpopulate, and eventually it'll just stamp out the bad bacteria. And this is a very passive, effective way to balance gut bacteria. I like GI Stability. GI Stability, I've mentioned it many times. This is an oleosaccharide, a human milk oleosaccharide. It's a non-digestible starch that babies get from breast milk. And it is the non-digestible starch that travels through a baby's digestive system, a newborn, to the gut where it feeds the bacteria, the good bacteria, helps it populate, helps it grow. You don't have to drink breast milk. They have been able to manufacture this human milk oleosaccharide in a artificial form, so to speak. And it's just a non-digestible starch. GI stability is this starch. You can take it. You take a couple of wafers a day. It passes through your upper GI pretty much untouched because it's non-digestible. And it gets to the colon where it feeds those bacteria. And it's going to help you reverse the gut dysbiosis. It's just one more thing that you really want to take care of if you have Parkinson's disease. Also, you want to take ginkgo. Ginkgo is going to increase the amount of blood flow into the brain dramatically. It's going to bring oxygen into the blood, nutrition into the blood. It is essential if you have Parkinson's for healthy cognition. It's going to improve your memory. It's going to make you feel better. You definitely need to take ginkgo as one of your main supplements when you're dealing with Parkinson's. Going back on the biggest threat to a Parkinson's patient, which is the free radical damage, I want to also bring up a story. 15 years ago, my wife developed a tremor in her hand. And I was a young doctor, and I freaked out, and I thought it looked like Parkinson's. I brought her to a neurologist in Naples, Florida. His name is Dr. David Perlmutter. He's very popular. He's retired now, but he's a celebrity neurologist. He used to be called the renegade neurologist, right? And he's written many books. I'm sure you've seen them, and you probably know who David Perlmutter is. We went to see Dr. Perlmutter. He evaluated my wife. He turned to me and said, this is not Parkinson's. Right? Wow, what a great diagnosis. But in the process of going through this and meeting Dr. Perlmutter, he was running at the time a clinic in Naples which specialized in the treatment of neurological degenerative conditions. And he was doing a lot of incredible things there with Parkinson's disease. One of the things he was doing intravenous treatment with glutathione. Now, glutathione is like the greatest antioxidant known to man, basically. And it's something that our body produces naturally. He would take a Parkinson's patient that would come into his office, could hardly walk, and was shaking with these tremors, put them on glutathione for a treatment time, and then afterwards they would get up and a lot of them would be able to walk without any problems. And this would last for several days. Truly remarkable. And so the issue with glutathione is that, of course, most people are not able to get themselves intravenous glutathione injections. And so it's always been a difficult chemical to get into the body. I used to, in my office, I never did intravenous injections, but in my office, I used to recommend nebulizing with glutathione. So you'd get a nebulizer, you'd mix glutathione with sodium bicarbonate powder to make it less acidic, and then you'd breathe the glutathione into the lungs, and it would get absorbed into the body that way. But it was messy, and it wasn't that effective, but it was better than somebody not doing it. Now they have come up with a product. It's called S-acetylglutathione. And this actually can get broken down and used with digestion. So we can take a capsule, we can get the glutathione, and this is essential. If you have Parkinson's, in fact, all of these things I'm telling you are essential things that you need to do in your routine. You certainly need to take this acetylglutathione. It's difficult to find. On my website, I have a link under the product page with a company called Zymogen. Zymogen does make it, and I have a link there. You can use the link. I managed to get a discount if you use that link where you can buy it with a little bit of a price break, although it's not very expensive. And this is something that you need to invest in right away. You need to get this glutathione in your system. If you saw those videos, and they may still be on YouTube, right? If you saw those videos, because Dr. Perlmutter posted them at one time, if you see these videos of patients with Parkinson's getting up and walking out of the office after they've had glutathione treatment, it's inspiring, and it'll really inspire you if you have Parkinson's to get on glutathione. Please investigate it and look into that. Another thing you can do to increase your body's natural production of glutathione, which is very important for Parkinson's, is a coffee enema. And I know that a lot of people are not going to do this because they have preconceived ideas about it, but it's no big deal, honestly. And I have in my book, Heal Yourself, I have a detailed explanation of how to do one of these coffee enemas. And you apply the coffee enema, you hold the coffee into the lower part of the colon for a little while, and the coffee stimulates a reflex that is going to cause your body to produce more glutathione naturally. So this is something that you really want to look into also if you have Parkinson's disease, right? Very important. You want to do everything you can with this disease. A couple of other honorable mentions. In practice, I did a treatment called pulse electromagnetic field therapy. I used a machine made by Pulse Centers called the XL Pro. These are expensive. They're about $30,000 a machine. I had a couple of them. These machines expose the system to a pulsed electromagnetic field. There's a lot of theories as to what this does and how it works, and I write about it extensively in my book that you can download, by the way, for free off my website, drstephenstokes.com. But I had Parkinson's patients that would do pulse electromagnetic field therapy. They do like 60 minutes of treatment. A lot of them would just lay on a bed. We would activate the system with the field. We would also do smaller paddles directly on the brain. I had some pretty interesting results with that. I had some of my Parkinson's patients that did really well with it, and they had an alleviation of their symptoms that would last sometimes for 2 to 3 days after a single treatment, which is very positive, right? I had other Parkinson's patients that after that treatment literally could not get out of the chair, had trouble breathing, and almost on several occasions felt they had to go to the emergency. Very scary. And the reason for this, I believe, is because one of the things that pulse electromagnetic field therapy does is it forces the cells of the body to detox, right? So it forces the cells of the body to release toxins and chemicals. And those come out of the cell, which is good, right? But they go into the bloodstream. And if a Parkinson's patient already has high levels of free radicals in the blood, which we know that's a problem because their liver's not working very good, then the pulse electromagnetic field treatment, it can literally poison the patient, right? So this is all powerful stuff. It's not fun and games. This is your life. You have to be very careful with these modalities. You have to speak to your doctor or your managing physician, right? Who's taking care of you, and discuss these different modalities before you just go and buy a PMF machine or something like that. But there is potential there. And with Parkinson's, we're looking for potential. It is a tailored treatment program, a tailored approach. Everybody is slightly different because everybody has different body chemistry. You have to be aware of these mechanisms. For example, the free radical problem, the liver problem, the circulation problem, the dopamine problem, and work on mechanisms. So I really hope that this was useful. If you have Parkinson's or if you want to know more, just reach out to me. You can call me on the phone. You can text me. You can reach out to me through my website. I offer conversation. I don't charge for it, right? This is something I do out of service, something I'm committed to, something I've committed my entire life to. And I do care. And I'd like to hear about your experiences and see if maybe there are some other areas that we can unlock that maybe you haven't considered. And then, of course, as always, check with your doctor. There's a physician. His name is Jeff. What's his name? Jeff Elias, or Jeff Elias, I think his name is. You can just Google that. It's Jeff. It's Elias. Is that right? Yes. Jeff Elias. He is doing things with ultrasound. They call it ultrasound surgery, I think, where he will take an ultrasound beam and define it into the size of a grain of rice and target the exact area of the brain which is causing some of these symptoms, right? And they'll zap it, right? It's like a cutlass surgery or something they call it. I'm not very good with these memes and these terms, but the point is you can pinpoint a very precise area of the brain without damaging anything else using ultrasound. Something you want to look into as well, because you may be able to dampen some of these devastating symptoms to allow you a functional lifestyle. And then, of course, if you're functioning, people say, well, why would you do that? Why would you just get rid of a symptom if you're not addressing the cause? Well, because if I can get rid of a patient's symptom, right? And think about this. If somebody is shaking and I can stop that shaking, okay, palliatively by deadening a nerve or something like that, and that allows that patient then to get up and to make a cup of coffee, to function, that's going to send all of this positive information to the brain. And the brain is going to say, wow, we're doing this again. And the brain is going to like that. And the brain is going to want to continue doing that activity and start to want to lay down new neurological pathways to make that happen. And so that is why, my friend, taking care of symptoms only without addressing the cause of the problem is not necessarily a bad thing when you're dealing with these chronic, basically incurable diseases. And I want you to keep that in mind. And I don't want you to be too hard on yourself because you're after symptom relief. It's okay. You can get symptom relief. Symptom relief leads to possibly permanent correction of certain disorders. It's important to understand that. I hope this was useful. Again, you can find out more about me on my website. Please subscribe to this channel, and I wish you all the best of health. Thank you.